Hi, I'm Dr. Sebastian Gonzalez, and the topic of this video is going to be compartment syndrome. Compartment syndrome actually is a pretty serious thing, although it can happen from traumatic types of cases like breaks and hemorrhaging within a compartment. And basically with this we're going to be talking down here. But at the same time, in this type of population with runners, it's actually more of an exertional type. Now the intent of this video is mainly to show you different anatomical structures in the area, figuring out what your basic anatomy is and if you have this problem at all in the first place. Lots of people try to go through usually to figure out, hey, maybe I can find some videos on how to stretch this area, but the fact of the matter is you don't know if you have it or not. You should always go see a doctor to figure out 100% what it is, but at the same time going in knowing anatomical structures yourself, I think it helps you figure out and communicate with your doctor better. Now compartment syndrome, the typical symptoms are, it'll come on usually after about 10 minutes or so, give or take, obviously a few minutes. It starts to decrease in pain. It's usually pretty severe at that point, usually after they stop. But more so, they're going to have they're going to have lots of sensation, either on the bottom of the foot or on the top. Depends which compartment we're talking about. If we're talking about posterior, we're going to be talking more about here. If we're talking about anterior, we're going to be talking more about here. With compartment syndrome, the main areas you'd be looking for in regards to the landmarks to figure out what you have is first, you would actually want to find, so if we're going to talk mainly about posterior compartment syndrome, so you're going to find the bone right here, and basically as you drop right off, you'll feel an area of softness. This is probably one of the easiest ways to find the posterior compartment, deep compartment rather. Other than that, you're going to have to drop through the superficial compartment, which is the soleus and the gastrocnemius and the Achilles tendon right around this area. So actually, if you can poke right in here and you'll feel that there's tenderness or not, and it feels full and swollen, that can be an indication that it would be compartment syndrome. But again, usually would have some type of correlated numbness or tingling, especially with posterior compartment syndrome, down this way when you're actually running. Posterior tibialis tendonitis and posterior shin splints, stuff like that can actually become very easily a compartment syndrome, because as there's problems within that deep compartment, imagine it being like a plastic bag that you keep blowing up. And eventually the pressure is very great inside. And essentially that's what happens when there's irritation, swelling, and problems within the muscles within that deep posterior compartment, and it irritates the posterior tibial nerve as it goes down the backside. Treatment-wise on this, actually I think it's a great idea to, you want to address it before it becomes compartment syndrome, obviously, but when it becomes too severe, many times you have to refer out for some type of release on the fascia. But basically what you would want to do is you want to be able to take the muscles of the compartment and release them enough to where they're not in that inflammatory state anymore. So basically the fluid and swelling around that area will decrease, and so will the tension, the pressure within that compartment as well. What I usually do is I try to work on not only the muscles of the deep posterior compartment, but also the fascia, the neuromuscular septum as they call it, between the two layers. Mainly with that, what I do is I would contact the point, I would lengthen the muscle, and basically try to remove some of the scar tissue and help it move better and decrease the inflammatory cycle. Thanks for watching, everyone, and feel free to go onto the website, check out the other videos we have. I've been trying to put out tons of videos educationally to basically teach everyone how to know their body better. There's actually a book as well. It's called Prevention of Overuse and Sports Injuries. I wrote it. It was on 10 different cases that basically I've had that I see continually throughout the years, and it seems like there's lots of different common factors that these people have that they probably could have prevented if they would have known about it ahead of time. So go ahead and check that book out, and thanks for watching.